All right. Hopefully this is recording appropriately, as I realized class did not record, so I'm doing a second brief recording of cannabis. Excited to be talking to you guys about this. And it's to help in those situations where maybe friends, family, patients are asking you about medical cannabis or medical marijuana and wanting your opinion on it, and providing you with some resources to make a patient-specific recommendation around cannabis products. So CBD, THC, cannabis, marijuana, it's all been in the news for many years. These are some older article headlines, and there's, again, often articles about these that patients are reading and different resources that they're getting mixed messages from. Some things saying there is no benefit, some things saying it's the benefit to everything. So a lot of potential misinformation out there. So really important for us to talk about as pharmacists. And so by the end of this, my goal is for that you to be able to define some of the key terminology around cannabis products, to be able to differentiate between the two main cannabinoids that we have most researched and studied, THC and CBD, that you'll be able to, at least on a high level, explain the legal status of cannabis products, both federally and at the state level, be able to briefly describe how to procure medical cannabis in the state of Maryland, identify some benefits and risks for its use, and then be able to apply these points to a specific patient case, being able to look at the appropriateness of cannabis for that specific patient, given the other comorbidities and medications that they're on, and then determine risk for cannabis toxicity and safety concerns based off of that. And then lastly, to identify resources to find more information. So one of the resources that's posted is this pharmacist letter chart that compares cannabinoid products. I think it's really helpful, provides a lot of insight on some of the main questions that you might have or that patients might have. So I encourage you to take a look at that. It's a pretty quick read. So using that article, what would you share with a colleague about CBD? So I would look at each of these as a true-false question, and which of the following are true. Hemp with 0.5 THC is legal per the Farm Bill. True or false? THC and CBD are the only cannabinoids. C, urine drug tests check for CBD. And D, common CBD effects include hyperemesis syndrome. If you're watching this, I would pause, take a look at this article, and see which of these you think is correct. I'm going to assume that you did pause and look this up and maybe found it a little bit challenging, because actually all of these things are incorrect. Hemp with greater than 0.3 or less than 0.3 rather of THC is legal per the Farm Bill. So it has to be less than 0.3, not 0.5. THC and CBD are just two of over hundreds of cannabinoids. Urine drug tests mainly test for THC. In class, we had a discussion about how in the state of Maryland, at least, many employers are taking THC off of employee drug screening since it is now approved for recreational use in the state of Maryland, but definitely check. This could be different employer by employer. Common CBD effects include hyperemesis syndrome. That is not a common side effect of CBD, but is a potential side effect of chronic use of THC. So actually, all of these are false statements. So a little bit on terminology. So really the term medical marijuana has fallen out of favor and has been widely replaced with medical cannabis. So marijuana has some negative connotations and even some racial connotations, and so is largely not used, but you might still hear patients use this and maybe even some providers use this. So I wanted to include that here. When people say this, they are referring to the whole unprocessed marijuana plant or cannabis plant. The FDA has not approved cannabis as a medicine, so keep that in mind. The cannabis plant has kind of two main varieties. And this is probably still not a great way of describing it, but cannabis does include hemp-like varieties, which have very low levels of THC, and then more kind of medical cannabis varieties, which have more THC and other components. So hemp is actually a crop that they make rope and twine and things like that out of. And it has pretty low levels of THC, as we just talked about. And this is the source of CBD oils. So these types of products are higher in CBD and low in THC. So when people talk about hemp or hemp-derived products, these are mostly CBD products. Cannabinoids include THC and CBD. So there's cannabinoids in hemp, there's cannabinoids in medical cannabis. The chemicals that we're going to talk about, the cannabinoids that we're going to talk about are THC and CBD, since we have studied these the most, but there are hundreds of these. Our body also produces components called cannabinoids. The FDA has approved some medications that contain some of them synthetic THC and CBD. And there's also synthetic forms that are available recreationally and many different names for those products. Terpenes is another thing that you'll commonly hear about, especially in medical cannabis, and they'll talk about kind of full spectrum or the entourage effect, meaning the effect of THC, CBD, and then the other components in cannabis products, and these include our terpenes. These are often what's associated with the smell of cannabis and with the essential oils in plants. So terpenes are not just unique to cannabis, there's terpenes in all plants. Another thing that you'll hear about commonly when reading or taking in content on cannabis is this elusive endocannabinoid system. And this is not well understood scientifically, so we won't talk about it at great length. I'm not going to ask a bunch of detailed questions about it. But essentially what I want you to know is that the body does have receptors all throughout the body that respond to these cannabinoids, mainly CB1 and CB2. And so this is where a lot of the both real and proposed effects of the cannabinoids take effect. So you'll see there's these receptors all over the body, some in the intestines and the CNS, just all over the place. And so this is what kind of supports all of the different effects that these different products have. I think this picture is probably oversimplifying it and maybe mis-explaining it a little bit, but kind of the point is that cannabis has different species, and there's some that are referred to as hemp that contain very little THC. And again, we don't really typically use the term marijuana, but there is more of the medical cannabis components that contain both a mix of CBD and THC. So I guess the main point is that cannabis has a lot of different varieties, and these varieties have different levels of THC and CBD and terpenes. So some of the main differences between the cannabinoids that we're going to talk about, THC and CBD, are listed here. THC is typically what the high that people experience when using cannabis products, specifically when heating them and so smoking them, can experience. Also, that increased appetite or kind of like the munchies you'll hear about is associated with the THC component, so you wouldn't see that with products that are mostly CBD. THC is also associated with decrease in pain, inflammation, and potential muscle control problems. So we'll talk about that more with kind of the evidence behind THC products for different things versus CBD products. CBD is non-psychoactive, so it doesn't produce that high. It's not popular for recreational use due to this, but it might have some use in reducing pain, inflammation, and does have an FDA-approved product for some specific types of seizures. And just a reminder that there's many other cannabinoids besides just these two. So which of these products are FDA approved? So I believe that you guys have already learned about dronabinol or Marinol. That is a synthetic product, which is THC. So A is actually the correct answer for this question. Nabilone is THC, not CBD. I've actually not seen this used here in the US. Epidiolex, though, is approved in the US for seizures, but it is not THC, it's CBD. And then the last product is both a mixture of CBD and THC, also one that I haven't seen on the market. So the answer to this, which of these are paired with the correct component, is A, dronabinol or Marinol is synthetic THC. You guys have learned this already. One of the main approved indications for dronabinol that you guys learned in PT is it's used for refractory nausea and vomiting. So just some overall benefits and risks. These are very similar to other dietary supplements that you learned with Dr. Moody. Technically, cannabis is not a dietary supplement, kind of in a category of its own. But some benefits are that patients do have potentially better access, especially in states that have legalized both medical cannabis and recreational cannabis. It could be less expensive. I know you guys are doing asthma right now, and some of those inhalers are hundreds of dollars, even the generic ones. So a cannabis product could potentially be less expensive than some of our expensive prescription products. We'll talk more about some of the indications that cannabis is used for here in the state of Maryland, but you'll notice that a lot of these are really difficult to treat with our prescription medication. So a lot of people that use cannabis products have tried prescription products and have tried other things. And then we know that patients often view things as natural as potentially safer or better, although, as you guys discussed with Dr. Moody, that's not always the case for our natural products. Which leads us to the risks. There is quite a bit of product variability, especially if you buy products from a less reputable source. A lot of the dispensaries actually come with a certificate of analysis that is tested by an outside lab and shares exactly the amounts of CBD, THC, terpenes, and other chemicals in the product. Unfortunately, there's very limited evidence for cannabis for many of the disease states that it's often touted for and used for. Part of this is due to limitations in it being difficult to fund and research studies on cannabis, since it is a controlled substance, a controlled one substance at the federal level. There's quite a bit of stigma around cannabis as well, which also compounds these issues. We'll talk more on some subsequent slides about specific side effects. Especially for products with THC, there is dependence, both physical and psychological, and withdrawal that patients experience if they've been taking these products regularly. Again, mostly THC-related products. There's an increased risk of car accidents with THC-related products. There's concerns about the smoking risk if these products are inhaled with vape pens or other means of inhaling. Also, drug interactions, which we'll talk more about in a second. And then As with any product that's a plant that you're eating, is product contamination. So cannabis is very prone to pulling heavy metals from the earth that it's grown in. And so if you do get that certificate of analysis from a reputable dispensary, it will actually check for those heavy metal products. So here's just a case that we'll come back to that I want you to keep in mind. You've got a friend with Crohn's disease. They've heard that CBD products might be helpful. She is a little skeptical about this. Ask your opinion because she's not really familiar with it. So what is a resource that you think might be helpful for efficacy and safety on this condition? Hopefully your answer was natural medicine. And we'll take a look at this in a little bit greater detail on some subsequent slides. But we'll look at efficacy and safety for CBD products. So a lot of times you'll see CBD as well as cannabis just being touted as having all of these different benefits. So promotes recovery from opioid addiction, cures cancer, stops epilepsy, lowers blood sugar, lessens arthritis. And while there is a grain of truth to some of these, there is not necessarily robust evidence for all of these things. So typically when things look too good to be true, not to be pessimistic, but to be realistic, it probably is. So some potential benefits for CBD and THC is that they can both potentially have some positive effects on pain. CBD specifically is approved as an anti-seizure medication under the brand name Epidiolex. As most plants are, can be an antioxidant, could potentially have some anti-anxiety effects and antipsychotic effects, although a lot of the effects can have the opposite in some patients. Could be a muscle relaxant, neuroprotective, and may reduce some of the undesirable effects of THC. So again, kind of that entourage effect that is often discussed with people that are promoting full cannabis products that have the spectrum of THC, CBD, and other components. For THC specifically, some evidence for use in pain, and use as an antiemetic, which we have a prescription product for, an appetite stimulant, which also we can use our prescription product for, and potential muscle relaxant. Unfortunately, there are some potential side effects as well, and you'll see that the effects are a little bit different with CBD versus THC, and again, that's why there's some proposals that some of these side effects might be able to cancel out if you're using a full spectrum product with both CBD and THC. So CBD, you'll see decreased weight, potential weight loss, while the opposite is the case for THC, increased appetite, which could lead to increased weight. CBD, diarrhea, dizziness, drowsiness, fatigue. So something that you might not want to drive with after using that product. THC, due to the psychoactive effects, might also not want to drive after. Dizziness with that one as well. One thing we've seen with the prescription cannabidiol products is this potential for liver injury, which is dose dependent. So could be best practice to check baseline liver function tests and then periodically with long-term use. THC, I think one of the main things is this euphoria and then also withdrawal when taking it for a long time and stopping it. Something we've also seen more of with the legalization of medical cannabis and recreational cannabis is hyperemesis syndrome, which is very much what it sounds like. Refractory nausea and vomiting. Sometimes people report to the emergency room with this. We'll talk about some treatments on the next slide. And then those other psychoactive effects. So feeling drunk, disturbances in attention, dizziness, sedation, all of these different things. Going back to the hyperemesis syndrome, also called cannabinoid hyperemesis syndrome, or CHS, the treatment for this is really to stop cannabis use, which again can be difficult and can cause withdrawal. In the short term, it's supportive care, so IV fluids if they're in the hospital due to severe dehydration, any electrolyte corrections that might need to take place. And then actually some surprising treatments like topical capsaicin cream, for example, can help and has kind of a similar effect to taking a hot shower or bath, which also helps in this particular syndrome. Other risks to keep in mind as pharmacists, there is a potential increase in warfarin levels. So we'll run some drug interaction reports here in a bit. THC and CBD are both metabolized by CYP450, so can have interactions where things that are also metabolized that can increase risk of toxicity with cannabis products. Also, compounding sedating effects. If you add these products, especially THC-containing products with opioids, benzos, muscle relaxants, and then neither CBD nor THC is recommended in pregnancy. It is considered unsafe both orally and inhaled. Cannabis does pass through the placenta and can reduce fetal growth and increase risk for preterm birth. So it is not recommended in pregnancy. So I want you to take a minute, pause, and put in this drug interaction on natural medicine and see what interactions you can find. I will also do it here with you. Hopefully I can remember each of these things. Let's see here. So we'll go to our interaction checker. We'll put in warfarin. We'll put in cannabis. We'll put in diltiazem. And clarithromycin. All right, so the main interaction we found is with warfarin, major. If we view the details, it says that concomitant use with cannabis seems to increase levels and clinical effects of warfarin. There's some case reports of patients chronically taking warfarin that developed a spike in their INR after smoking cannabis or taking medical cannabis orally. The dose smoked by the third patient is unknown, but they include the doses from those patients. For the interaction with clarithromycin, it's a moderate interaction. Looks like largely theoretical that it might increase levels and increase risk of toxicity from cannabis. And I believe that's the same interaction that we see when looking at diltiazem, that it can increase levels of cannabis, thus increasing risk of toxicity from cannabis. So going back to our patient here. So we see one major interaction, two moderate interactions. For counseling the patient, I would say, like, ultimately it is up to you whether you want to use cannabis or not. If you are going to take warfarin and use cannabis products, I recommend that we monitor your INR a little bit more closely. And this can put you at risk of increased bleeds if you take them both together. Taking clarithromycin and diltiazem, these can actually also increase risk of cannabis toxicity. So taking all of these things together could result in some concerning side effects. We talked a little bit about drug screens already. These test for THC specifically, since this is the psychoactive cannabinoid product. A positive result can last for 7 to 10 days. If very heavy, extensive use, can be positive up to 6 weeks. Typically, a CBD-containing product that is touted as being CBD and not a combination product shouldn't test positive, but there can be some products that end up being advertised as CBD and having high levels of THC. So it would be important to get a certificate of analysis to help confirm that a product truly is CBD. And if you get your products from a dispensary in Maryland, they typically come with that certificate of analysis. So we already talked a little bit about regulation that cannabis is still a Schedule I controlled substance under federal law. Hemp with less than 3% THC or less is not federally controlled. But each state has their own regulations. Typically, this federal law is not really upheld federally. And so each state is what really enforces cannabis laws. So what's the status in Maryland? We'll actually look at that on a following slide. Currently, 39 of the 50 states have legalized medical cannabis, and many have legalized recreational cannabis as well. Here's a map showing the different regulations of cannabis products, with black being legalized or even recreational use. You'll see that Maryland is one of those states. In July of 2023, adults 21 and older were allowed now to possess recreational use of cannabis up to 1.5 ounces and cultivate up to 2 plants. And since this time, regulations in Maryland have drastically decreased, and this has led to some employers not even testing THC on their drug panels. For medical cannabis, it is regulated by the Maryland Cannabis Administration, who has an online portal for patients, providers, and dispensaries. So you can see a screenshot of it here. You can register as a new patient, register as a caregiver, or find a provider. So I'll give you a couple of minutes to take a look at what new patients need to register, what medical conditions apply, and what the 3-step process is. All right, so if you want to register as a new patient, you'll see that any individual who lives in the state of Maryland, whose provider recommends medical cannabis, can, for a qualifying medical condition, is eligible to register as a patient. The qualifying medical conditions are listed here, and there's also a catch-all for other chronic medical conditions which are severe and for which treatments are ineffective. So you'll see here all of the registration process. So patients that are interested have to register, and then they also need to find a provider to prescribe it for them. A cannabis prescription is not exactly a prescription since it's not necessarily a medication, but it's still, they get a kind of certificate from a provider that they can then take to a dispensary. All right, so lastly, we're going to go back to our case of our patient with Crohn's disease. She wants to try CBD oil. She wants to know what doses have been studied, what adverse effects are possible, and is taking sulfasalazine, so wondering if there is any sort of interaction. Oops, sorry. So let's take a look at this. We will hop back over to natural medicine. Since she is specifically looking at CBD, we're going to put that in. Cannabidiol. I don't think I'm spelling that right. Let's see here. There we go. So here's the professional monograph. We could click this, or this is also all of the components of the monograph. So I think the first question was, is there a drug interaction? I'm going to go back to that one since I've already gotten over here, and I'm going to look at effectiveness first. All right. So as we won't be surprised, it's likely effective for epilepsy, which we know Epidiolex is a prescription product of CBD for epilepsy. Insufficient reliable evidence to rate for anxiety and all of these other things. We're going to look specifically for Crohn's disease. Here it is. It says it's unclear. Let's look at some details. It says a small study in adults with Crohn's disease shows that taking cannabidiol oil, 10 milligrams twice a day for 8 weeks, does not alter disease activity or C-reactive protein, which is the marker of inflammation, when compared with placebo. An additional small clinical study in patients with mild to moderate Crohn's disease shows that using cannabis oil containing cannabidiol and THC and then gradually titrated to a max of 100 milligrams twice daily for 8 weeks in conjunction with standard care did improve patient satisfaction in some symptoms such as abdominal pain and bowel movements, but unfortunately did not improve disease activity scores or endoscopic findings. So we could share that with our friend to say that it looks like our study with the cannabidiol oil is 10 milligrams twice a day, although didn't alter disease activity or C protein. A product with a mixture of them up to 160 milligrams twice daily did show some symptom improvement, but did also not improve disease activity scores. So kind of unclear, again, as it's summarized above, if there's any benefit to this. The other thing that we were looking at is safety. So possibly safe when used orally and appropriately. Up to doses of 200 milligrams have been studied to be safe. As far as adverse effects, you'll see that generally it's well tolerated. Although orally, dry mouth is somewhat common, so up to 30%, and then diarrhea in 24%. Also that decreased appetite, drowsiness, dry mouth, and these potential for abnormal liver tests. If we want to do that interaction checker, we'll put that in. Sulfasalazine. And you'll see that there's no interaction for these. So that's good. What other counseling points might you share? If we go back, oops, spelling this even worse. It's going downhill. I did want to show you one of your fellow colleagues pointed out these patient handouts. There is an English one that shares some information on effectiveness, safety, interactions, and some discussion on food. So this might be also a helpful thing to print out and share with your patient. So in summary, some take-home points. It can be very confusing to discuss the different components of cannabis, as there's many different products with many different mixtures of CBD, THC, and other components. Cannabis is still on the federal level a Control 1, which makes it challenging to study. Although both medical and recreational cannabis are legal here in Maryland, there are many valid pros to trying cannabis as well as cons. So really need to take this on a case-by-case basis on determining whether this would be a good product for yourself, your friends, family, patients. And then just be aware that regulations and medical information on this topic are often changing, and you'll need to stay up to date on this after graduating. Just a reminder that there is a brief assessment in Canvas for you to do, and it is due by 4/24.